So hospitals across the country, Dr. Labos, are reporting high numbers of children ending up in hospital. CHEO, for example, the Children's Hospital in Ottawa, reporting double the usual number of kids in Emerge and 2/3 of them coming in with COVID symptoms. We're hearing similar accounts from doctors in Saskatchewan. What are the risks for children in Canada right now?
Well, the risks are there. And, listen, children are obviously going to be at lower risk than adults, but lower risk doesn't mean zero risk. And when you have a virus that spreads far and wide and is spread so easily from person to person, even if the infection rate is lower, even if the attack rate is lower, just by virtue of the fact that it spreads so far, it means more children will end up in a hospital. So a highly infectious virus, even if it's a mild one, can put significant strain on the healthcare system. So while I don't think we need to panic or worry, we should acknowledge that very basic things are going to make a big difference in terms of keeping children out of hospital. Number one is make sure they get vaccinated if they're eligible, right? So if they're over 5, and that's why wearing masks has a benefit. They limit the spread of the virus, and they are an easy, low cost, effective, side effect free way to stop person to person transmission.
You mentioned, of course, the younger children still don't have access to vaccine, but in Canada, just 40% of kids 5 to 11 are fully vaccinated. So there's a lot out there don't have that full protection. Could you offer some advice to parents then, I'm thinking, Dr. Labos, who might be concerned? What are the symptoms to watch for, and when should they take a child to hospital?
So the problem with COVID, of course, is that the symptoms can be so nonspecific. They can be different, from person to person, and they can be different in kids between adults to some degree. For the most part, this is still a respiratory virus. It's going to be, fever, shortness of breath, cough. Kids, there has been some suggestion in some reports that kids are more likely to have gastrointestinal symptoms, so more likely to have atypical symptoms like that. But I think you have to use your judgment. If you see your child is very, very sick, and if you're not sure if it's COVID and they're struggling a little bit, it's probably better to be safe rather than sorry and seek medical attention. Now, it doesn't necessarily have to be the emergency room. It can be your, regular doctor. It can be an urgent care clinic. As long as you tell them in advance that you're worried about COVID and other infectious agents, they can take appropriate precautions. But it's really, if there's a doubt, you seek medical attention, because if you're not sure, it's always better to be safe. The worst that's going to happen is they're going to send you home. So you got to sort of balance the risks and the benefits of seeking medical care.
You mentioned COVID as still primarily a respiratory illness. There's some very interesting reporting on CBCNews.ca about headaches as a symptom of COVID. And people are telling us at CBC News this is, one of the worst symptoms, one of the longest lasting. There's a lot of research going into this right now, the whole question of linkage of headaches and COVID. What could the possible correlation be?
That's still very unclear. I mean, this sort of ties in almost to some degree to this issue with long COVID and the brain fog and the neurological complications that we see after that. It's not entirely clear what's going on. Is there a persistent inflammatory state in some of the neurological tissue that's leading to these symptoms? That's what people speculate. But the reality is, I don't think anybody knows. The most important thing, though, is that if you are having these persistent headaches after COVID, make sure it's not something else. Make sure you don't have atypical migraines, for example. Make sure you don't have some other problem that you're confusing with COVID, because that might actually be treatable. The headaches with COVID and the persistent symptoms that last for some time afterwards, as of right now, there's not really anything that we can do about it per se. The one sort of silver lining to all this is that the symptoms that persist after COVID do seem to get better with time. They can last for months, but they do improve over the course of time. So at least some reason for hope on the part of people who are still suffering from this.
But if somebody right now in this 6th wave should get a headache, might that be an indication to take a test right now as a symptom of possible COVID infection? And then long-lasting headaches, that's something else entirely to watch for.
Yeah, so if your only symptom is headaches, and especially if you're, interacting with other people and could have been infected, then yes, you should definitely test for COVID. Again, worst case scenario, the test will come back negative. But if there's any doubt in your mind with regarding to your symptomatology, take the test. Access to rapid tests is now, fairly widespread and easy. acknowledge the issue with false negatives, of course, but if there's a doubt in your mind, take the test. You're always going to be better off doing the test than not doing the test.
So that's an interesting piece up on CBCNews.ca, as I was mentioning. And there's another one that caught my attention to conclude with you today, and that is out of British Columbia. The British Columbia government has told distilleries to stop producing hand sanitizer. You'll remember, when this began, brewers and distillers did the big conversion, and they started to produce hand sanitizer because there was such a demand. The BC government, Dr. Labos, gave a statement to us at CBC News saying that stopping that production is in line with their lifting mask mandates and vaccine card requirements. But I was still thinking, even though things are easing, what do we still need to keep in mind, Dr. Labos, for good hand hygiene right now?
So for you as an individual, the best way to clean your hands is really soap and water. The advantage of hand sanitizer, it's the convenience when you're not near a sink. And so, there are certain situations where it's obviously helpful to have that, especially if you're not at home or not at a restaurant, right, where you can wash your hands. But for most people in most situations, wash your hands with soap and water. That's going to do more than enough to clean all the bacteria off of your hands to prevent you from getting sick. Having hand sanitizer is useful for those situations where you just don't have access to that sort of thing. But it doesn't have to be the default product that people use. Just washing your hands is going to be the most important thing.
But we still need to keep up those practices. Is that right?
Yes, even if COVID magically goes away, which it probably won't, but there are plenty of reasons to wash your hands. A friend of mine was interviewing some young school children about the lifting of the mask mandate, and the children were like, "Oh, I'm so excited. I can't wait to stop washing my hands." And you have to tell her, no, honey, you have to keep washing your hands forever. That's just good practice. It has a rule.
It sure is. I thought it bore reminding today,
Yeah.
even though they're stopping the production or scaling it back. Dr. Labos, as always, thanks for the time.
My pleasure. You take care.